Okay, so going on to allergic rhinitis, it's a very common condition that's affecting a lot of our people. Worldwide, it affects about 10 to 20% of the population. In Singapore, it's estimated about 5.5% of the adult population may suffer from allergic rhinitis, and this number increases in school-going children up to 40%. And it has associated comorbidities such as asthma, atopic dermatitis, and eczema, as well as allergic conjunctivitis. And so you can imagine that this does lead to high socio-economic costs, as well as possibly depriving children from attending school on certain days. The diagnosis is based on 2 or more of the following symptoms for more than 1 hour on most days. That of rhinorrhea, which is watery and anterior, sneezing, nasal obstruction, nasal pruritus or itch, plus minus conjunctivitis. And symptoms which are not really suggestive of allergic rhinitis would be if the patient has unilateral symptoms, has a thick or discolored nasal discharge, has headaches or facial pain, loss of smell or a foul smell in the nose, and epistaxis. Of course, epistaxis may be related to allergic rhinitis, but if the patient has purely epistaxis without any other allergy symptoms, one would want to just make sure that there's nothing else that is causing the epistaxis in the patient. So the ARIA classification has divided allergic rhinitis into these 4 categories in terms of the frequency, whether the allergic rhinitis is intermittent, as defined less than 4 days per week or less than 4 weeks, or persistent, meaning more than 4 days per week and more than 4 weeks. And in terms of the severity of the allergic rhinitis, into whether the patient has mild symptoms or whether the patient has moderate or severe symptoms. And most patients, when they come to see us, would have already moderate or severe, because if you look at the classification, mild symptoms basically means that the patient has nothing really that's impacting his daily life, which if you think about most patients when they come to see us for allergic rhinitis, there's something that's bothering them. If not, they wouldn't present to our clinic. So how do we treat allergic rhinitis? These are the 4 pillars of treatment of allergic rhinitis. And so if you look at there, allergen avoidance is indicated when possible. Patient education is always indicated. Pharmacotherapy is something which is very widely used, and it's safe and efficacious, as well as being easy to administer. In patients who may have more recalcitrant symptoms, they may require some form of allergy testing, and the allergy testing may reveal what allergens they are allergic to, and so with that knowledge, the patients can then be able to try to avoid the precipitating factors. Immunotherapy is the last